And sorry. So let's talk about the flu because a lot of people are suffering through it right now. Norton Children's is seeing a high flu activity in our area, especially driven by the flu B strain. Dr. Heather Felton with Norton Children's Hospital is talking to us today about things that you can do to keep yourself, your family safe, and what options you have when it comes to the flu as well. So she's going to be speaking with us about this. Again, this is Dr. Heather Felton with Norton Children's Hospital. Let's jump in and listen.
Different subtypes. Usually in the first half of the flu season, we see lots of flu A. And if you remember right before Christmas, we had a huge surge in cases of flu A and then kind of a lull. But then the second half of flu season, which is usually the late winter and early spring, we tend to get lots of cases of influenza B, which is what we're seeing now.
And what is the difference between flu A and flu B?
They're just different subtypes. Both tend to be pretty mild in the fact that they can have things like fever, muscle aches, fatigue, headache. Sometimes you can get stomach pain, vomiting, decreased appetite, but they can both progress to more serious complications too. Some children require hospitalization or a trip to the emergency room. And so what we want to do is to try to prevent kids from getting flu and then getting them the help that they need quickly if they do develop an infection.
What are the best ways to prevent flu?
The best way is to get your flu vaccine. And so we still have those available and we'll be giving them out until we run out of them, usually around March or April. But if you haven't gotten your flu vaccine yet this year, it's still a good idea to get one. And I think it's important to keep in mind that if it's their first year getting the flu vaccine and they aren't at least 9 years old yet, then they actually need 2 doses in that same flu season in order to be fully covered. Otherwise, I recommend practicing the public health guidelines, things like washing your hands, covering your nose and mouth when you cough or sneeze, and staying home when you're sick.
And, some of the symptoms you mentioned earlier, they can apply to a lot of different things. Is there a way to kind of discern the difference between one or the other?
The only for sure way to discern that infection is flu is by doing a flu test. You can't just look at somebody or do an exam and know for sure that it's flu or that it isn't. In my experience, kids with flu tend to look a little bit weaker, a little bit more tired than a kid with just another kind of normal cold virus. But you can get a wide variety of presentations. So the only way that you can know for sure is with a flu test.
Okay. And then I guess last for me, before I open it up to questions, I see we've got at least one. When is that point where a parent should maybe go the urgent care ER route versus their pediatrician's office?
I think it's a good idea to call your pediatrician's office first in most cases. And so if you just have concerns because they've had a fever, because it's been going on for a few days, they've been tired, not acting like themselves, that's definitely your pediatrician's office or immediate care. If you have a child who is experiencing difficulty breathing, if you're having trouble waking them up, if they seem dehydrated, so like not making a lot of wet diapers, not able to drink or keep anything down, then those are usually a trip to the emergency room.
Okay, Paul, go ahead with your question.
Hi, good afternoon, Dr. Felton. Thanks for speaking with us. A couple of questions here in regards to the latest numbers. Norton Children's is reporting 2,500 pediatric flu cases in the past week, 5 hospitalizations. Do we know how many of those are vaccinated or not vaccinated?
I don't have those numbers in front of me, Dakota. I don't know if you do or not.
I don't have them in front of me, Paul, but I can certainly look into that for you.
What are you saying, doctor, as far as vaccination rates among children in this area?
In the last couple of years, I think we've seen fewer families decide to get their children the flu vaccine, which I think does explain why we've had 2 bad flu seasons in a row with a lot of flu cases. I always recommend it for people. Even healthy children can get very sick with the flu. And so I recommend that you get your flu vaccine every year.
And can you put this season in context for us as far as how it compares with previous flu seasons?
This one has been worse than last year. And last year, I believe, was also a record-setting year. So we're seeing really high levels of flu in the area.
Thank you.
Okay, I see a couple hands raised. Jose, I believe you had your hand raised.
Hey there, can you hear me? Hello?
Can't hear you, Myra,
You
if you're
can't
trying
hear
to
me?
ask a question.
Okay. Can you hear me now?
Yes.
Okay. All right. Thanks for that. All right, Dr. Felton, thanks so much for doing this for us. A couple of questions, but can you talk a little bit about how should parents determine where they should take their kids based on symptoms, ER versus your regular pediatrician, urgent care? And also, can you talk about people who have concerns about the vaccines, what they should know about the flu vaccine, and dispel any myths?
Yeah, of course. So if a child is having difficulty, like you're having difficulty waking them up, or if they seem like they are in respiratory distress, having trouble breathing, if they seem dehydrated, meaning they aren't able to take in liquids, they aren't using the restroom or making wet diapers, if they are vomiting profusely, then I would say that those are a trip to the ER. I do think that your pediatrician's office is a good first call. You can call your pediatrician's office and ask if they would recommend an appointment for that day or a trip to the emergency room. Because we're seeing so many different cases, if your doctor's office is full and they aren't able to see you that day, then it's a good idea to take them to immediate care if you feel like you can't wait for a next day appointment. As far as the flu vaccine goes, I see lots of different concerns that people have, and a lot of people can have many different concerns about it. I think some of the most common ones are that they're concerned that you could get the flu from the flu vaccine. It's not possible for that to happen from the flu shot because it's an inactivated vaccine, so it couldn't cause you to get the flu. Sometimes you can experience things like a little bit of muscle soreness or fatigue after getting a vaccine, but that's your immune system turning on and making antibodies. It also takes a couple of weeks for the flu vaccine to develop immunity. So if you get your flu vaccine, but you've already been exposed to the flu and your body hasn't had time to make that immunity, you could get sick before the vaccine has a chance to really work. And so some people make that false connection that it was the flu vaccine's fault for them getting sick. Sometimes people have concerns that it's just not a good match, and that can certainly change and vary year to year. But even if it doesn't prevent disease entirely, we usually do see kids who get the flu have a milder course of illness if they received the flu vaccine. I get it every year. I always give it to my kids every year. And so I continue to recommend it for my patients.
Okay. Does anybody else have a question for Dr. Felton?
Dr. Felton, this is Paul again. When will this end? When do you expect the season to come to an end?
Usually the flu season ends sometime around March or April. It varies a little bit every year, but it usually goes well into the spring.
Does spring break play into this in any way, much like the holiday break?
I think that we see a little bit less as people go outdoors. They spend more time being able to space apart and not always inside. So when the weather is nicer and we travel outside and we're not confined indoors all the time, that helps. When the air starts to get a little bit more humid and less dry, that can also help as well. But certainly when you go traveling, you want to think about the possibility for infection. So if you're going to be taking a long car ride or in an airplane, you're sharing that airspace with everybody else you're traveling with.
And the flu B, the B strain you're talking about here, which is more common in children, if you're an adult around a child who has the B strain flu, how susceptible are you? Does this carry over to adults, much like it does with children?
You can still get flu B even in adults. And so I see it where it gets passed around among family members. And so I've still had children come into my office, but their parents tell me that they've been sick too. Sometimes adults, because they're older, because their airways are bigger, because maybe their immune system is a little bit stronger, they're able to fight off infections a little bit easier, or their disease is more mild and they may not realize that they had the flu. But usually there's some indication that they've been a little bit more congested, a little bit more tired, and they're thinking that maybe they caught it too from their children.
Okay, Conroy, do you have a question?
Yes, Dr. Felton, thank you again for taking some time with us this afternoon. Just thinking about how this is the second year in a row that we've seen a rising trend in flu cases. And I know these trends ebb and flow over the years, depending on the virus, the strain, but just thinking ahead to, let's say next fall, past the point that Paul was just asking about, what can Norton or what can the community do to try and raise awareness about this, to try and prevent a third straight year of potentially rising cases? And also, what can individual families do ahead of the next flu season, which I understand is months away?
So we usually start giving out the flu vaccine sometime in late September or early October. And we recommend getting your flu vaccine before Halloween. So we say flu before boo. And that gives your immune system a chance to be prepared and to have built antibodies ahead of flu season. And so I usually recommend that. Norton often has flu clinics or flu vaccination sites where it's really easy to stop in and get your flu vaccine. And I really recommend those events to try to plan ahead of holiday travel and before the weather gets too cold and kids are inside all the time. I think that that's a really good idea. I think the conversations that we have around vaccines, talking about it in a positive way, because as we're seeing this big increase in the number of flu cases, it's corresponding with a real decrease in our vaccination rates. And so I really do think that those two things are related. And then I think talking to our kids and educating them about good hand hygiene and covering their nose and mouth and giving families space when they need to stay home with a sick child is also really important to help to prevent the spread of disease.
And Lillian, I don't know if you saw in the chat the answer to your question, but for the good of the group, that 2,500 number we sent out, that's mostly Jefferson County and Southern Indiana cases, but we're also seeing some in Shelby and Bullitt counties.
Doctor, I'm sorry, Dr. Felton. How long can a child have the virus before symptoms set in?
That's a great question. So you can experience flu symptoms for maybe around a week or so. And this would be like fevers, cough, congestion, feeling achy and tired. But a lot of times after a viral infection, you can have a post-viral cough that may last 10 to 14 days after that. And so it may be several weeks before you're really feeling 100% back to yourself. So it can take a while to recover.
What about before the symptoms set in? How long? I mean, is it possible a child can be running around school and around the house with the virus, yet not show any symptoms?
I think that that's a great question too. It's usually several days ahead of the first symptoms appearing. So you may have a child who's recently traveled or who's been at a school function, maybe 3 to 5 days ahead of time, where they've been exposed, but they're not showing symptoms yet.
Thank you.
Okay, any other questions? Okay, Dr. Felton, do you feel anything was missed? Is there anything else you wanted to add?
There are a couple of antiviral medications that are available for treatment of flu, but they do have to be started within 48 hours of symptom onset. And so if you have concerns that it could be the flu, if you're interested in something, a medication like that, then it's a good idea to reach out to your doctor earlier rather than later.
Thank you so much. Thank you to everybody joining. Like I mentioned at the top of this, we've got that link that we'll send out along with the recording of this avail. That kind of is a webpage dedicated to helping parents and families figure out where best to take their child when they're sick. And that is it. We'll get those materials out to you guys shortly. Thank you, everyone, for your time today.
All right, folks, thanks so much for staying with me here on this stream. A lot of good information coming from Norton Children's, talking about the flu, what you can do to protect your children and yourself, your family. They are confirming more than 2,500 pediatric flu cases in the past week and 5 hospitalizations. That's a huge number, folks. So we know a lot of folks having the flu is not fun. If you've been there, you know that it is awful. Maybe you're watching this right now, you're home with your kiddos right now. They are probably struggling too. So the best thing that you can do is practice good hand hygiene, stay home if you're sick, get that flu vaccine. And if you want to share this along with your loved ones, please feel free to do that. And again, folks, stay healthy. Have a great day. I'm Myra Ansari.